Imagine healthy people living in equitable and resilient communities on a thriving planet. We have learned so much together over the last 20 years. When scientists cracked the genetic code, there was enormous hope that genetic manipulation could reverse a whole host of debilitating and chronic diseases. And while that promise still exists, we now know that our zip code is a better indicator of our health status than our genetic code. That the social and environmental conditions that we face in where we live and work have a profound impact on our health. We now understand that economic inequities lead to health inequities. If you don't have a stable job and healthy food and a decent place to live, it's going to be really difficult to keep your health and your family's health intact. We have learned over the last 20 years that if we're going to turn around the epidemic of obesity and diabetes, it's not going to be through individual solutions alone. We need to create healthy and affordable food culture in the communities that we serve. Over the last 20 years, we've learned that we're all exposed to toxic chemicals in our daily lives, poisons that have invaded our food, our water, our air, our cosmetics, our furniture, our products, even our bodies of our children. These exposures have contributed to a plague of chronic diseases and cancer among them, which now affects 1 in 2 men and 1 in 3 women. And this isn't just affecting our patients. This is affecting all of us, our families, and ourselves. And even during this conference, many people have come up to me and shared with me that they either have cancer themselves or that there's cancer among their family members. We've also begun to understand about the devastating impacts that fossil fuels have on our health, including 6 million people who die each year from air pollution, from the combustion of fossil fuels, twice as many people as AIDS, malaria, and TB combined. We're learning that burning fossil fuels can also impact the developing brains of our children, leading to a loss of IQ and contributing to learning disabilities. And these same exposures, we're learning, contribute to dementia and Alzheimer's disease. And we know that fossil fuels are the leading contributor to climate change, which came home to America this year in hurricanes in Puerto Rico, Florida, Texas, and wildfires in California, Montana, Washington State. We are all wounded by this social addiction to fossil fuels, which now threatens our entire civilization's ability to thrive. In this new and perilous moment, we are learning that accelerating the transition away from fossil fuels and toxic chemicals is a global public health imperative. In this new and perilous moment, what is healthcare for? What is our highest purpose together? We have a historic opportunity to expand our healing mission to heal the communities that we serve and to the planet that sustains us all. We, all of us, providers, clinicians, operations staff, architects, medical supply companies, insurers, food service, we all have enormous gifts to bring to this moment. We operate in the only sector that has a moral underpinning to first do no harm. We employ more people than any other sector of the economy. We're trusted by the public. So we are incredibly well positioned to play a transformative role in the communities that we serve. For much of the last 20 years, we focused on addressing the environmental footprint of our facilities and supply chain. We've reduced our waste volume. We've closed more than 4,000 incinerators. We eliminated mercury and other dangerous chemicals from our facilities. We reduced our energy consumption through efficiency and now starting to buy renewable energy. We've gotten fast food and junk food out of our hospitals and are now creating healing environments in our facilities. This work is all part of our healing mission, and we have a lot to be proud of, and we'll celebrate a lot of that this evening. But now, how can we go further? How can we utilize our knowledge, our economic and political clout to create equitable and resilient communities? How can we embed health and justice into the DNA of our purchasing decisions? How can we move beyond doing less harm and create healing in the community at a community level and a planetary level in partnership with many, many others in our ecosystem? When we use our purchasing power to partner with other institutions like schools and universities to create guaranteed markets for sustainable farming, we help support both community health and wealth creation. When we invest in farms that grow food for our facilities, as well as link the farm with therapeutic interventions for patients and educational venue for children, we start to see food as medicine. And this creates a cascading set of benefits that goes from modeling food environments to growing community cohesion. When we co-invest in renewable energy projects that provide reliable and healthy energy for our facilities, but also for the communities around our facilities, then we're creating resilience and healing at a community and planetary level. When we support programs that address the asthma triggers in people's homes rather than waiting for the same kids to come back to the emergency room, when we co-invest with other partners in creating healthy housing, then we start to see housing as a vaccine against a host of preventable diseases. When we use our powerful voice to help support policies to accelerate our society's transformation to renewable energy and away from more pipelines and drilling and coal mining, we're engaged in planetary healing. We have come to a moment in history when the health sector is transforming itself from treating patients who are seriously ill to moving upstream to address the environmental assaults, the economic inequities, and the racial injustice that are making people sick in the first place. So we stand on a threshold of breaking out of an old medical paradigm, redefining our mission in the 21st century, and expanding the architecture of collaboration in our communities. Let us learn together as we become planetary healers. Imagine healthy people living in equitable and resilient communities on a thriving planet. Imagine. Imagine.